My name is Chelsea and I'm a SANE nurse at Moab Regional Hospital.
My name is Carrie and I'm a nurse at Moab Regional Hospital.
Hi, my name is Jess. I'm a nurse here at Moab Regional Hospital.
Hi, my name is Misty Kovacs and I'm a registered nurse at Moab Regional Hospital.
SANE stands for Sexual Assault Nurse Examiner. We are registered nurses that have received special training in order to perform evidence collection and provide counseling and prophylactic health care after a sexual assault. This could include, medications for prevention of disease or pregnancy.
Treatment, exams, and any medications are free of charge to the victim due to state funding.
Also, provide education and support patients in receiving the help that they need and connecting with resources outside of the hospital.
We partner with several other agencies. We actually meet monthly to discuss how we can better serve the people who go through this terrible experience. So we work a lot with Seekhaven. They're the women and family shelter here in town. They provide advocates that are specially trained in working with victims of sexual assault. They receive 40 hours of training and they will come to the hospital and be with you during this whole experience. They also provide follow-up services, help you with getting appointments. Counseling is also something that they can link you to and provide. We also work closely with the Children's Justice Center. They provide the same services as the same nurses at the hospital and a Seekhaven, and they focus specifically on those victims who are under the age of 18 and their families. We also partner with state-level organizations as well. One of the key ones for sexual assault is the SAKI. It's a Sexual Assault Kit Initiative. They actually have a tracking system where you can track your kit and see where it is throughout the whole system, whether it's being processed at the lab, the crime lab, or if it's back with law enforcement. And they also have their own advocates to help you track your kit and find out what's going to happen next. If you belong to an organization that has contact with sexual assault victims and you feel like being part of that multidisciplinary meeting would be beneficial to your organization, we would love to hear from you. We have made some reach outs to other agencies, but we know that there's a lot of points of contact in the community for victims of sexual assault, and we'd like to really streamline our services that we can all provide and work together.
Why you should get a SANE exam. So the first reason is because it makes the evidence available to try to find the perpetrator. And if law enforcement isn't able to make a match, the next best reason is because it provides evidence, and that evidence helps build towards statistics to get more funding to provide better services for people who have been a victim of sexual assault. And remember that we're here to support you and to provide help during this difficult time.
What does a victim look like? A victim looks like all the people around you. The numbers of people who have suffered sexual assault, some form of sexual assault in their lifetime, are incredibly high. Regardless of what your sex, gender, or sexual identity is, whatever your age is, it happens across all socioeconomic classes, across all age groups, across all identities and genders. And we are trained to help every group, and that's what we want to do.
I really appreciate the empowerment and autonomy that we can provide to our patients. We see people oftentimes on one of the worst days of their lives, and our goal is to kind of help make that day a turning point for these patients. My goal is to help each patient that we see that comes to us as a victim leave seeing themselves as a survivor.